You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. And we're discussing replacing missing teeth with dental implants. With us, we have an expert on the topic, Dr. Charles Boley. Dr. Boley, welcome to the program.
Thank you. I'm glad to be here.
Now, before we get into today's topic, for people that don't know your practice, you have a fairly large practice. Who's your typical patient, and what are the different procedures that you offer?
Well, the name of our practice is Boley Family Dentistry, and that's who we want to see. We want to see your whole family. I mean, from little Johnny to great grandma, we want to see everybody in between. And we do whatever you need to do. We like to be a one-stop shop. If you need dental work done, we want you to be able to do it with us, and that includes your regular cleanings. If you need a tooth out, if you need a crown, the whole cosmetic work, we can do that for you. If you need partials, dentures, implants, but where we really made our bread and butter, where we made our name, was sedation dentistry. We love.
Is that big, by the way? Popular, I should say?
Well, it's not done by a whole lot of people, but we love to do it. It's our favorite thing.
Who's getting it?
The person who gets it the most is the anxious person. But what we're seeing more and more is the busy person. And so everyone knows the dental phobic. I mean, come on, lots of people don't like to come to the dentist. We get it. We understand you don't like to come see us, so we've made ways to take down those barriers to the things you don't like. We want to make it easier for you, and that's to be sedated. Make it easy with sedation. That's what we like to tell you. But on the other side of that is the busy person. Randy Alvarez needs some work done. He hadn't been to the dentist in 5 years.
In fact, they just recently called me. It's like I got to make the time to go over there.
So you've been so busy being successful running the Wellness Hour that you've neglected your dental work. But you don't have time to come in 5 or 6 times to get all this caught up. With sedation, we can do that in one appointment. If you need crowns or fillings done or a tooth taken out, you come in one time, you're sedated. We may take care of years of neglect. And it may be
in one day, same day.
It may be a 4 or 5 or 6 hour dental appointment. You don't care how long it is because you don't remember it, or you remember very little of it.
It's safe.
Safe. You are safer sedated than you are not sedated. You may freak out, have a anxiety attack, your blood pressure goes through the roof, you're just going, you hate every second of it. When you're sedated, that's what happens to you.
Now, is it true? I mean, very few, I guess less than 5% of general dentists across the country even do sedation?
Correct. And less than that do IV sedation. And we have 5 dentists in our practice who can do IV sedation for you.
Okay, now, today's topic, we're talking about dental implants. Who are the typical patients that are coming in for dental implants?
Well, we see the full gamut of implant patients. It may be a person who lost one tooth. It cracked, it's had an old filling in it from when they were a kid, and it was lost. Tooth was gone, and that person wants a single tooth replaced. Next level up is multi-tooth loss. Maybe you lost a couple teeth down here, you put 2 implants in, and you make a dental bridge, a standard dental bridge, but over implants. And then the third is the person who has a hopeless mouth. You know, they say, is this the worst mouth you've ever seen?
Do you get a lot of that?
Well, people say that to us. It's really hard to have the worst mouth we've ever seen, I promise you. But a lot of people come in and say, oh, I'm embarrassed for you to look in my mouth.
Is that right?
Don't be embarrassed. We know what you're going through. We are there to help you with those problems. And they may have a hopeless bite, a hopeless mouth. They're going to lose all their teeth. And we want to give them options so it doesn't ruin their life. And we see that happen. Okay,
and now the denture wearers.
Yes.
At the beginning of the program, we said no more dentures. Is that the future of dentistry?
Well, it's a denture, but not in the traditional denture that your grandma had. Okay. We want you to be able to have a denture that doesn't float around in your mouth, that doesn't cause sore spots, doesn't move every time you talk. You don't have to take it out and clean underneath it after every meal. We want a denture that replicates your original teeth.
Because it's attached to something?
It's attached to your jaw. It snaps in and snaps out. It's not this floaty denture that people think of when they think of traditional dentures.
I think you told me on the phone that there are people that can walk in on the day of the procedure, walk in without teeth, walk out with teeth.
That is our standard procedure. You walk in, we put 2 or 4 implants in, depending on what you need. You walk out that day with a snap-in denture, and you were eating dinner that night with your new implants and snap-in denture.
Is that right?
That's how we like
So you
to
can
do
eat
it.
right away?
Oh, right away. Absolutely.
Do you
Now,
hear eating stories from patients?
we want you to start maybe with some softer foods. You don't take a new pair of hiking boots and go on a big hike. You break the boots in, okay? So we want you to break your denture in. Eat some softer foods and work your way up. But when you talk to somebody who haven't bit into a carrot in years, who haven't bit into a piece of celery, that whenever they cook their vegetables, they have to cook them to mush because they can't chew them. And that person now wants a crisp salad. They want steamed vegetables instead of boiled vegetables. Just imagine, well, we can imagine what that's like to not be able to do those simple things that we take for granted every day, and they are grateful.
Are there a lot of people where you are, let's say within an hour of your practice, that have either an upper or lower denture?
Unfortunately, that is true. There's a high rate of tooth loss in the state
Like
of
thousands?
Kentucky.
Would you say thousands? Tens of thousands?
Absolutely, thousands of people within 50 miles of our practice who wear dentures.
If it's so good to lock down that denture with dental implants, why aren't they all doing it?
Well, most
What's
people,
your take?
A lot of people don't know about it, which is why we do things like this. It's why we go on Channel 6 to educate the population. But if you imagine your life with dentistry, if you have gone and lost all your teeth and now you wear a denture. If you had a good experience, did you grow up keeping your teeth? No, you grew up losing your teeth. You grew up with toothaches and broken teeth and abscesses and pain and bad dental experiences. The last thing you want to do is come back in to see a dentist. I'm done with that part of my life is done. I'm done with dentists. You know, I've got dentures. That's it. And so they're not really looking. They're not looking for an answer. All their friends have the same problems. Their parents had the same problems. They think that's their life. But there's brand new options, things that will make it where you don't have to go through the whole sore spot adhesive, can't chew, don't look good. Another reason people haven't come in and had this process done is they think they're too old. And that is simply not the case.
How old can you be?
Let me tell you something. When I first got out of dental school, my grandmother was 85 years old, and she sat down across from me and she gave me the old grandma thing, you know, got that finger out, and you pay attention when that happens. And she says, don't ever treat an old person like they're too old to have something done, because you live your life until you're done. And that has resonated with me. And so there is no too old. I mean, when do you want to give up on life?
90? Can a 90-year-old do this?
I've done implants on a 91-year-old.
Really?
91-year-old. She was a joy. I wish all my patients were her.
Are they more likely to fall out at that age?
If they're healthy, if they're a healthy person, there's no reason you can't do that. So let me tell you about this 91-year-old woman. She was tired of her denture. She couldn't eat. She didn't like how she looked. So we put 4 implants in on her, turned it, boom, snap-in denture. So she loves it. So when I hear a 75-year-old say, I'm too old to have this done, it's like, come on, you can do this. This will work. This will improve your life. It will change your life. You will not regret making yourself better.
So 4 implants, so I'm clear. You get a full arch of teeth that snap in. Is that right?
We can do it with 2. But with 2, you still have a rock, of a front-to-back rock. And we know that, yes, you can do it that way, and that's better than having nothing. But when you put 4 in and that thing goes boom, snap, it's in, it doesn't move, it works its best. If I'm going to have it done, if anyone in my family is going to have it done, I'm going to do at least 4.
But isn't it true that if you've been in dentures like 30 years, you don't have enough bone to do this?
It used to be true. It's not anymore. 5 years ago, if you were that person, we didn't have an answer for you unless it was something really, really extensive. These days, we have totally new techniques, totally new implants, totally new imaging systems, and we have an answer for you. We can almost always give you something that's going to improve your situation.
Okay, I want to go to a question, something you said in our green room, and people need to know, we're talking about no more dentures here, replacing missing teeth with dental implants, and people need to know also that this is a real interview, that you're giving your truth. I'm not trying to endorse you here, but you said, as far as imaging, you said, I'd like people to know, never go to a dentist that's going to do a dental implant if they don't have this CT. Elaborate on that. What did you mean by that?
We have a CT scanner in our office, and you stand in it, it circles around your head, and it takes a 3-dimensional image of your jaw. I take that and I do your entire treatment virtually while you're waiting. It just takes a couple minutes. I virtually do your entire case on the computer. So I know from soup to nuts, beginning to end, what that case is going to look like, where I'm going to place your implants so that you're going to get the best result. Where I'm putting that implant in, I'm already thinking about the last step when I'm doing the first step. If you're going to multiple doctors, multiple practices, they're not thinking about the last step when they're doing the first step. They're just doing the first step. That's all they care about. So we can do a more valuable service for you if we do it from beginning to end.
Okay, what about the way they look? I feel like I could always spot a denture walking down the street. Is there a cosmetic aspect to this?
Well, there's very much a cosmetic aspect, and there's good dentures and there's bad dentures, and if someone smiles and you look at it and go, oh, that's a good looking denture, and our viewpoint, that's a fail. We want you to smile and they go, that's a good looking smile. Not a good looking denture. We want it to look natural. We want people to think that's you. And so that's our goal, not for someone to say good looking denture, good looking smile.
So you have a team at your office. It's not just you.
Now, we have multiple doctors in our practice, and they're all trained the same way. But when you come in and you start your relationship with one of our doctors, then that is your doctor. That doctor is going to take care of you. Now, if you want to see a particular doctor when you call in, just ask for that doctor, and you can get that one. But we're not bouncing you around with different people. You know, you're going to have one of our doctors, and they're going to be your personal dentist.
What about pain, though? It seems like a very painful procedure.
It does, doesn't it? I mean, when I describe it to you.
Sounds painful.
I'm going to put this down into your jaw. That sounds like it hurts. It sounds like it hurts to me, but here's the trick. It doesn't. Now, of course, I'm going to give you a prescription in case there's tenderness afterwards. What we hear every day from implants is, I took one pain pill in case it was going to hurt. I really didn't need that, and that's all I took. Here's the story. The surgical procedure of implants has changed so much, just like surgeries in the hospital. Everything's gotten smaller, quicker, faster. We just put a little bitty hole, put that implant in, and the trauma to your gums is so much less than it used to be. The surgical aspect of the procedure is so much simpler than it used to be, that there's so less of trauma that the pain quotient goes to zero.
Yeah, but what about people that their mouth's a mess? You said there's another category of patients that their teeth are literally falling out. If they have gum disease or bad gums, what are their options?
They still have the full range of options in front of them. Don't think for a second because you have gum disease, your mom and dad lost their teeth to gum disease, you got a brother or a cousin lost their teeth to gum disease, that you can't get implants. And here's why. When we take those teeth out, there's no reason you can't have gum disease with no teeth.
Is that right?
The gums heal, the bone heals, all the infection goes away, and now you have healthy tissue. We can put implants in that healthy tissue.
With denture wearers, though, and I know a few denture wearers, they never seem to complain to me. Are you saying there's no such thing as a happy denture wearer?
Well, I understand why they don't complain to you, because they come and they complain to me. All right. I hear their stories about how they can't laugh, how they can't eat, how they're unhappy, how they can't do the things they used to do. They go to a restaurant to order, and they know they're going to have to eat in front of their friends, and they have to order something that they know they consume with their denture, and it's not going to be what everybody else is having. Wearing dentures is not a replacement for teeth. It's a total compromise. Having dentures is just a replacement for having no teeth. Don't put those two things together. Don't get confused. Having teeth, having dentures. People with dentures can't do the things that you can do with your natural teeth.
Now, you've made dentures in the past in your practice.
Sure.
Is that correct? And I'm sure a few of those patients are going to see this program. What do you say to them?
We have new tricks, okay? Come back, come talk to us. We can take that denture, especially if we made it and we know the principles used in your denture. We can probably just use your old denture in one appointment. One appointment, Randy. Put in 2 or 4 implants, snap.
So you just make snaps in their existing denture?
Absolutely. We attach their existing denture to the new implants, and they walk in with their old denture, they walk out with implants in that denture, and now they're chewing and smiling with confidence.
On the consult, when they go to see you, are they skeptical? Or what do they say? I mean, what do they want to know? What are the frequently asked questions?
If they know about it or we're telling them about it, the first thing they think is, this is going to hurt. And we've talked a little bit about that. And so, know that what you have to go through to have the implants put in and the denture made and to snap in is tons easier than when you had all your teeth taken out. It's tons easier than having one tooth taken out. Far less pain from 4 implants than having one tooth taken out. So that's a big thing. A second thing is finances. They don't know what it's going to cost, or they think it's going to cost too much. And so we have financing for you.
Because insurance doesn't cover this, or Medicare does not cover this,
No.
but you'll work with them, right?
We're going to do everything we can if you want to have it done to help you get financing so that you can do it. And try to spread those payments out if we need to do that.
You think whether it's 20 years or 50 years that there will be no dentures the way we see them today? Everything will be attached to something?
If you know someone, if you wear dentures and your buddy, your best friend down the street goes and has that done, the first thing they're going to do is going to tell you, you have to do this. I mean, there's no comparison. I mean, this is the way to do it. I would never go back. I mean, people would, I've never heard, take my implants out, I don't like this. No, they wouldn't go back. Try to take their implants away from them and see what happened.
So you brought a model.
Mm-hmm.
What are the options for dentures? And take me through that consult process when you're telling them about their options.
Sure. If they're a person who has dentures and they come in, we like to show them this little model, and I may say, you know, just take your tongue and flip your denture up a little bit. And of course, they can do that. It
is that easy?
They can just, sure, it just floats right up, and there's nothing to hold on to. And then I show them this little model, and I go, well, looky here. Looky here. You know, this one stays in. How'd you like to have one like that? And that.
You do that to them?
Oh yeah, their eyes light up, because if they have no concept of the snap-in denture, this says it all. And then if I can pop that denture out, see, it's. If
okay,
I could,
come on. I'm going to try that next. Let's take a look.
So I'd like to hear you.
So let me see underneath that, by the way, and
Sure.
I'll get our cameras a look at that. So underneath there is you got a little fasten.
Sure, a little gasket into the denture, snaps into the implant.
Mm-hmm.
And that's what holds it in, the little rubber gasket. But then when you snap it in, that's what we like. This
Let me take a
denture-
look. Well, let me see here. Okay. So we got, you're right. I thought you were exaggerating, by the
Well,
way.
my hands are a little moist. And
Okay.
yeah.
So this is nice. So on the camera you can see, so you could use their existing denture,
Absolutely.
but you prefer, I don't want to put words in your mouth, but do you prefer to make a brand new one that's maybe better looking or cosmetic?
If this patient has a proper bite and the teeth are not completely worn, I have no problem using your existing denture.
Now you're a dentist.
Yes.
So you think the teeth are pretty important. How important is a smile, in your opinion?
The smile is everything, Randy. Let me tell you, I read a study recently about 2 groups of people were handed a picture of the same person. And in one photo, the person was smiling, and the other photo, the person was not smiling. They said, just tell me what you think about this person from the picture. The person smiling was graded as being more charismatic, having more leadership, being more successful, and obviously being more friendly. 2 people walk in a room, one's smiling, one's not smiling. Who do you want to talk to? You want to talk to the smiling one. And so if you're a person who's afraid to smile, put your hand over when you laugh because you don't like what your smile looks like, and we can transform you into someone who is proud of your smile, then that is great. I had a woman a while back, had a car wreck, knocked out 3 front teeth. She wanted a bridge. For this woman, she needed 3 implants. You don't always, it could have been 2, but we put 3 implants in, and it changed her life. And what she said when she came back, we followed up, she said, I'm more attractive to my husband than I used to be, and you know what that means. So did that change her life? She's happier. So we like to do things like that.
So you see transformations every week, I mean, in your practice?
The one that means the most to me was Bobby, as a man. He's in his 80s. I don't remember exactly how old he was. He was living in assisted living, and his family brought Bobby in, and they said, he won't eat. He won't come out of his room. The staff has to take him his food every day. He's not eating it, and he's losing weight. Essentially, he was a failure to thrive. He was just fading. And they said, you have to help him. So he had a nice personality. He wasn't fighting us helping him. He just wasn't happy. So we made him a new denture. On the lower, put 4 in, snap-in denture. Now, he's the life of the party in the assisted living. He goes out, he eats, he's going to the social hours, he's watching movies with other people. You know, he's happy. And he was depressed and fading, and now he's happy to be there.
So a recap of the options then for denture wearers.
Well, you can start with two, and you can put two implants in and snap it in. That has a little wobble, but it's not three-dimensional, it's two-dimensional, and you can rock back and forth a little bit. So we like to do four, if you can't do two. So four goes in, boom, 1, 2, 3, 4, it's not going anywhere.
Is that pretty well locked in?
That gives you a great result. That is getting closer to feeling like you have your own teeth again. With the two, people don't tell us that, but their denture doesn't move as much. So they like that, it's a step up. Four goes in. When you really want to go to the high end and people say, I want everything to feel like as much as my natural teeth as I can get it, then we can put 6 in, put a denture in that doesn't come in and out. You're not putting that denture in the glass and the Polident at night for cleaning. It goes in, it stays in, and that makes you feel like you have your teeth
So
back.
that's a full arch of teeth. They don't come in and out. It
Full
sounds
arch
like
of
everybody
teeth.
wants that. I mean, wouldn't everybody want that?
Yes, they would, but of course it's a higher end.
So a little bit
price.
more money.
A little more expensive. It's not harder to do. It's no harder in the procedure, but just a little bit more money.
Are there misconceptions about dental implants that you hear that maybe drive you crazy?
I'm too old. It costs too much. It hurts too much. I don't have enough bone. I just don't want to put myself through that. I'm doing okay with what I have. We hear all those things, but if you could wear this for a day, you would never go back.
Is that right?
So
if there's tens of thousands of people within an hour of your practice in Kentucky, you couldn't even service all these people.
if everybody
came to their senses,
everybody came to their senses and says, golly, I believe them, that's what I want to do, there'd be a line out the door. We'd have to do our best to take care of them.
But it is that much better. Now, with that fixed set of teeth, what can you eat?
What do you want to eat?
I mean, could you eat like corn on the cob or bite into a carrot, broccoli, whatever?
That baby is locked in, okay? That denture is there. You can't move it. You can't get it out.
Meat? You could tear through meat?
You can bite into a sandwich. You can do the corn on the cob. You can do the apple. Now, let's have some sense here. Let's don't bite things you shouldn't bite. Let's don't break things, okay?
Like ice or whatever.
I don't want you chewing on rocks, okay? Other than that, if it's a food your buddy's eating, you can eat it.
Now, what about a health? Because you say a 92-year-old did it. But, if you're 75, 80, that's young today, but 75, what if you're on a few medications, like arthritis medications or...
No, that's no problem.
Or type 2 diabetes?
It's rare that we have a person we can't help unless they're just truly unhealthy. If you're truly unhealthy, a lot's going on in your life, but if you're stable in your health, we can work with you.
So stable, like a little bit of type 2 diabetes, maybe,
if you're controlled. Diabetes, right. You have to, there's some, you want to be careful that you're controlled with diabetes before you do implants.
So as long as it's under control.
As long as you're stable.
And you could be on medications and get this done.
Absolutely.
All right, and you mentioned about bone too, because going into this, I did some Google searching, and that bone kept coming up. But you say that that's usually not an issue. Have you ever had to turn anybody away because you say, hey, you just don't have enough bone, you can't do this?
Since we got the imaging, we don't turn people away. We have options for you.
Are there people that have been told at other dental offices that you don't have enough bone, and then they go see you because they heard you maybe or saw you on TV?
Exactly. They saw us on TV. I was talking about it, and they come in and they say, my dentist told me I'm too old. My dentist told me I don't have enough bone, and I feel like I'm sentenced to this death of dentures for the rest of my life.
I don't mean to laugh. I'm picking up on your enthusiasm, but what do you say to that when they say I was told elsewhere I couldn't do it?
Let's do a scan. Let's see what it looks like. But I know most likely we're going to be able to do something for you.
Is that right? So routinely, like once a month?
No, that's every week.
Every week somebody's told elsewhere you can't do this, and then you guys can do it.
Don't go somewhere that can't give you a scan. If they can't scan you and know what you have, then they can't make a recommendation on implants.
And you have free consultations.
Absolutely.
A lot of people are charging consultations for this.
This free scan. This is a free scan.
A free scan too?
You come in, we're going to scan you. We want you to do this because we know how it can change your life. We know how it can benefit you. We know that we can make you a happier person if you can laugh, chew, smile.
Now that group of people we haven't talked a lot about, but the people trying to avoid dentures. That means they know their teeth are bad.
Okay.
They know they don't want dentures.
All right.
And their gums are bad, and they've got bleeding gums and all that stuff. You could probably help them too. Is that right?
Absolutely. I mean, if you're in bad shape and you're eventually going to lose your teeth, and you know in your heart that that's the case, let us plan that process for you. Don't just go down one tooth at a time and go through all the pain and
Do
the
people do that?
Oh my gosh. What we see, people's plans are to wait till it didn't hurt, so I didn't fix it. Well, that means your plan is to have a toothache. And so we deal with that person every day. You know, it didn't hurt, so I didn't do anything. How you doing today, Joe? That tooth's not so good, right? So you will have a far better result if you let us help you be treated and not have a toothache than to wait for the toothache and have the pain and expense of the abscess and things like that.
Are men the worst at this, meaning they put off procedures until they absolutely can't deal with the pain?
You know, I hate to talk about my gender in a bad way, but that might be true.
Is that right?
Yeah, men are usually
Do you have
worse.
spouses ever pushing their...
Oh, well, when I walk into a
husbands in?
denture consult room and the wife is sitting there, then we know who the boss is in the room, okay? And I want to make sure I talk to both those people, because usually the wife has brought the spouse in, and I may ask the spouse, so, you know, you have any pain, anything bother you? No, not really. Yes, it does. You told me last night that hurt you when you ate, and so, you know, the guy is kind of reluctant and doesn't want to show weakness, and the wife is there to say, you've got to do something to help him because he's miserable.
We are out of time. I want to thank you so much for coming on this show.
Thank you.
But final message to people that they're wearing a denture. What do you say to them?
If you're wearing a denture, come to our office. Let us do a scan, free consultation. We'll tell you what your options are. There's no reason you should be out there with the compromise of a denture that you may not like, that you have to wear the adhesive, that you're having sore spots, you can't eat, chew, and smile. You can't eat the things you want to eat. You might be able to eat, but not like you used to. Come in, find out what your options are, find out what the financing is, and let us see if we can help you.
And what's the turnaround? If somebody's watching this, if everything works out right, the denture wear, how soon could they be walking around with teeth that are hooked onto dental implants?
If you're wearing a denture and it was made properly, it's just you don't have any bone, it might be your next appointment and you're done. And we might be able to do that in one appointment. If you need a new denture, we'll go through that process, and then it's one surgery appointment.
Thank you for coming on the program. We're out of time.
It's a pleasure. Thank you.
Excellent. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.